Hello, my name is Dr. Erin Denil with Rejuvenate Life Chiropractic, and today I'm going to be doing a video talking about the different techniques that I use in my practice. Every chiropractor is a little different, so I'm going to be going through some of the techniques that I use with my patients so people can have a better understanding of what it is that I do. I would ask if you find good information out of this video, please do like and share it, as well as subscribe to my YouTube channel. Feel free to leave comments. I will respond as best I can. If you have suggestions for videos that you'd like to see, please do write that down in the comments section as well. I can definitely work on getting those videos out to you. When one person has a question, usually other people do too, so it helps. It allows me to tailor the content of this YouTube channel for you. Okay, so chiropractors, what do? We've got this major category called manual therapy techniques, manual medicine. Okay, so there's lots of research right now going on under the whole theme, the broad theme of manual medicine. What do we do, physically? How does the body respond to different things? In my office, I do hand techniques and instrument techniques. I work with myofascial release, either with an instrument or with my hands. I will do something called instrument-assisted soft tissue mobilization, which uses a tool to help break up scar tissue. I use organ techniques, so different breathing techniques, as well as muscle energy. And then I use a low-level laser therapy in my office. How an adjustment, okay, that's a chiropractic term for how we're restoring nervous system function. How an adjustment works is via a part of the muscle or the tendon and the ligament. Ligament holds bone to bone. Together, a tendon holds the muscle to the bone. We have these receptors. So for example, pain, temperature, pressure are all receptors. We pick up that information, we can sense it, vibration. One of them, the Golgi tendon, organ, and muscle spindles, okay, both these two receptors are going to sense either tension or stretch. So the techniques that we use focus on communicating with those things. When we use that type of communication, we send a message up to the brain interprets it, and then it's going to change something, either internal organ-wise or muscle-wise, to help us. The goal in my office is functional. So I want to see people get better from a functional standpoint. I want to see that they're able to do things that they weren't able to do previously, and or get back to doing those things that they want to do. So that's where I get super excited, is to see an area of the body that's stuck and not working, and then we're able to get that working again. So talking about this in a little more depth, we already did the overview. This is a plastic spine. Okay, so I warn you, it's plastic. It is not a cadaver. I get lots of kids that ask me that when they're in the office. Is that a real spine? And they get scared. Nothing to be scared of. It's just plastic. When we are using hand techniques, we're going to be placing areas on different spots of the spine and giving a light force thrust into the body. There may be a sound like a snap, crackle, pop sound. It's not Rice Krispies. What it is it's a gas exchange between the joint, and you have a layer of fluid that's between the joints so that you don't have friction, and there can be air that gets released or moved through, and that's what we're hearing. So when you hear the knuckle cracking, same type of thing, a gas exchange between the joint. On the spine, these little bony knobs that are sticking out along the back on real thin people when they bend forward, and you can see the little knobs. Those are the spinous processes, and the outside ones are the transverse processes. So I'm going to represent these with my fingers: spinous process, transverse process. And these are two vertebrae that'll be up on top of one another. Okay. When we have a joint, that joint normally goes through nice motions, we can move around, we have full range of motion. If we get a joint that gets stuck, It can get stuck for several reasons. We can have an accident or injury that would cause a shift. We could have a chronic muscle tension, tightness from emotions. It could be from posture, from sitting all day, typing. Any of these things can make it so we don't go through a full range of motion. When we don't move through that full range of motion, then we get little adhesions that start to form. Then it becomes harder and harder to move it. So our force adjustments are going to be able to break those things up physically, as well as some of the muscle techniques can help break up that scar tissue. Okay, the muscle spindle and Golgi tendon organ that I was talking about, those are also communicating in this process. So hands, I use my hands, okay. In the neck, the adjustments usually sound louder. The cavitation, that's what we call that gas exchange, is just louder because it's closer to the ears. And there's something else called bone conduction, which your ears sense the vibration. This is an impulse adjuster. Some people use an activator. Some people have other named tools. But this puts a nice pulse into the area. It stimulates the stretch that we want in those Golgi tendon organs and muscle spindles. Okay, so I may use this all over. And some people, they literally will ask me, what is that even doing? It's talking to the brain via Golgi tendon organs and muscle spindles. But in general, I have to know exactly where I need to place and put this in order for it to be effective. Okay. One of the things that is important to remember with any healing modality is anything that has the potential to do good also has the potential to do harm. So that is either hands or instruments that I use for my adjusting, mobilization, manipulation. I also use my fingers to hold different trigger points or areas where fascia has bunched up. The term fascia is simply, it's a sheet-like connective tissue that is going to connect everything in the body. It can wind and it can get overwound. It will cover all the organs. It covers each and every little muscle cell. So the fascia is a big deal. It has a lot of these receptors, okay, that we talk about that communicate with the brain. So when it gets bunched and knotted, we need to release that and let it go so that we can have proper communication. So besides my hands that I use on those areas, I also have a percussor instrument that uses vibration, and it uses a pulse up and down. This is not a massager. This is not going back and forth. Some of you may see things going around on Facebook. This is a professional version of that up and down motion because its frequency and everything that this machine is designed for is to help release that fascia. So there are differences. So just remember that could be some very great things out there, but could also be some things that are not being as effective as they should. I use something called the Assisted Soft Tissue Mobilization. In this case, I use a gua sha tool. Some people use Graston in chiropractic. Others will use a rock blade. I use this one is my favorite. I just use it's gua sha in Oriental medicine. I use a oil, like a fractionated coconut oil, and this helps break up scar tissue. Now I want you to see, and we'll see if you can see that it's getting red. This is inflammatory process, right? If we have inflammation in the body, it's going to get red, it's going to get hot, it's going to swell so that white blood cells can get in there and heal things up. Clotting would start taking place, and it can have some pain as well. I don't usually do it that hard. As you can see, I'm actually putting quite a bit of pressure on here, and all I'm getting is red. That's the common response. However, sometimes blood vessels will break and some little red dots called petechia will show up. There may be small bruises. When someone gets a technique like this, they will be sore for about 24 to 48 hours. If it's something like a shoulder, it will feel kind of like they re-injured it. I am gently peeling back layers of scar tissue, okay, from an onion, okay, peeling back those layers and allowing the body to heal. okay, in a better position. So we're going to get the brain communicating with all of the manual techniques that I do, as well as instruments, and then we're going to break down that scar tissue and just really let the body go. Okay, now I can re-heal from a really good base with my brain working and communicating with those receptor sites as they should. I use visceral techniques for the abdomen. Viscera is just a fancy word for organ, and it's different breathing techniques, different finger techniques, different compression techniques that I use to help with the internal organs as well, as far as making sure that they have the proper movement, because they need to move too, so they have their own motion pattern as well. I use a low-level laser therapy or cold laser in my office. It requires skin contact. It's going to have light that stimulates something inside of the cell. So think little tiny cell, little organ called the mitochondria. It is our energy producer. It produces ATP. So in general, healing is just sped up with the more energy we have in cells. So that is another technique that may be used in the office in addition to the other ones. So again, this is what I do in my office. I'm Dr. Erin Denil with Rejuvenate Life Chiropractic. If you found today's video helpful, please like, please share, please comment. Any suggestions that you'd have for more videos, subscribe to the YouTube channel. I will be putting more of these out. And that is just a little bit of what I do in my practice in a nutshell from the different techniques. So I hope you have a fabulous day. Again, sayonara.